Get a little closer here. Get a little closer. Are we good to go? I got you. Good? You're all right, boss.
Thank you, Governor.
All right. That's what we do. Good morning, everyone.
Good morning.
Thank you for being here with us today. I want to begin by acknowledging several of the elected officials who are here. You're going to hear from many of them, but let me acknowledge some that you won't be hearing from, but are incredibly invested in this announcement today and in this important community of Kensington and the city of Philadelphia where we are. I want to recognize and thank Councilman Jimmy Harity, Councilwoman Sharon Vaughn. I want to recognize Senator Sharif Street, who is with us, our good friend, Senator Jimmy Dillon, Representative Danilo Burgos, Councilman Mark Squilla, who I saw as well. I hope I'm not missing anybody. Senator Street will clean me up afterwards if we can. I want to, and Councilman Driscoll is here. Or somewhere. There he is. All right. Yeah, she's going to talk. We're okay. We're going to hear from her in a moment. Today, I am back in Kensington at the center of the opioid crisis in Pennsylvania to announce another step my administration is taking to battle this scourge. Around 300,000 Pennsylvanians suffer from substance use disorder, and every day we lose nearly 15 Pennsylvanians to drug overdose. That's 15 family members, 15 sons or daughters, aunts or uncles, 15 people that we care about in our communities. 15 people every single day who are no longer with us. This is devastating to people all across this Commonwealth. From right here in Kensington, all the way to the other corner of Pennsylvania in Erie. We cannot let our friends and neighbors battle this alone. They need meaningful support. Not a lot of talk, but meaningful support. That's why my administration is building on the work I did as Attorney General to take a multidisciplinary approach to battling this epidemic. We're investing in treatment, prevention, and law enforcement to get people the help they need and get the drug dealers peddling these poisons off our streets. And to that end, I want to thank Chief Kitzinger and others from law enforcement who are here with us today. But they know, and I know, and we all know that we are facing new battles every single day across Pennsylvania. Drug dealers have begun to cut opioids like fentanyl with a drug called xylazine, otherwise known as Tranq. Xylazine is a powerful tranquilizer. It's literally used on large animals like horses, and it's never been approved for use with humans. Dealers have started to do this because cutting fentanyl with xylazine extends the high, but it makes these already dangerous drugs even more deadly and more harmful. The drug slows down your breathing and your heart rate. The combination of xylazine and opioids can stop your heart and your lungs entirely. And overdose reversal drugs like naloxone don't work on xylazine because it's not an opioid. We can see the impact of these drugs on our streets when you walk down the streets here in Kensington and across other places in Pennsylvania. It causes painful wounds and skin lesions that can actually require amputation if it goes untreated. It's heartbreaking to see, truly heartbreaking. And this crisis is growing. Consider these facts for a moment. Back in 2017, when I served as the state's attorney general, xylazine contributed to about 90 overdose deaths that year. Last year, it contributed to over 620 overdose deaths, an increase of nearly 700% in just 5 years. But consider this further. Xylazine also went from being detected in only one county in the Commonwealth back in 2017, right here in Philadelphia, to being found in at least 37 counties in 2021. Why do I say at least? Because we know these numbers are underreported because not every county tracks the presence of xylazine in these drugs. This drug is a serious threat, even more so because a lot of times when people take it, they don't even realize it's mixed in with the fentanyl that they're purchasing. There's no easy testing like there are fentanyl test strips for xylazine, but it's already being found in about 90% of the drug supply right here in Philadelphia. I'm sure the Philadelphia Police Department will comment on that. On top of that, we've seen nitazines, a class of novel synthetic opioids that have never been approved for any use in the United States, entering our drug supply. In the last few years, we've seen 5 overdose deaths in Pennsylvania that have been connected to nitazines, but the number is likely much higher because, again, we don't routinely check for them on tox screens. That's why today I'm back here in Kensington, as I said I would be, to announce that I've directed the State Department of Health, under the leadership of Acting Secretary Deborah Bogan, to schedule xylazine as a Schedule III narcotic. In addition, I've directed the Department of Health to schedule nitazines as a Schedule I narcotic. As governor, I have the authority through my Secretary of Health to temporarily schedule substances that pose an imminent hazard to public safety for at least 1 year. I know this is something that Senator Tartaglione and others have been calling for quite some time. Scheduling these drugs allows us to put tighter controls, security, and record-keeping requirements in place to keep them out of our communities. Manufacturers must now add additional checks into their processes to verify that a recipient is authorized to receive the drug before shipping it. There's tighter requirements around the delivery of scheduled drugs to guarantee that the person who ordered it is actually the one who signed for it. And scheduled drugs must be stored in locked facilities. It also gives law enforcement the ability to charge and have another tool at their disposal. And it gives prosecutors, if they choose to do so, the opportunity to prosecute people for having this in their possession. Now look, veterinarians who use xylazine, they have no reason to worry if they're using it for legitimate purposes. They will still have access to it for their work. But taking this step will make it harder for these dangerous drugs to be used illegally and illicitly, and it will also raise awareness that the danger of xylazine, of tranq, is playing in our community. I believe this is an important step, but it's also just one part of the multidisciplinary approach that we need to take that I spoke of a moment ago. We need to bring enforcement, prevention, and treatment together in order to tackle this crisis. Drug addiction is a disease, not a crime, and we need to treat it that way. As Attorney General, you'll recall that I took on the pharmaceutical companies and have been able to bring back $2.2 billion to this Commonwealth for treatment and prevention-related services. Now those funds are being driven out in part by the Pennsylvania Department of Drug and Alcohol Programs under the leadership of Acting Secretary Dr. Latika Davis-Jones, who's here with us today. Back in February, DDAP awarded more than $9 million in grants to support counties' mental health and substance use programs as a result of that settlement. And millions more from that settlement are going directly to our counties to support their efforts. Here in Philadelphia, that's a decision being made by council and your mayor. I believe substance use disorder is a disease, not a crime, as I said a moment ago, and people suffering from it deserve better access to treatment and better treatment in their communities. We will work with our community partners to get Pennsylvanians suffering from substance use disorder and addiction the treatment that they need and that they deserve. And we will work with our partners in law enforcement to get these drugs out of our communities and make sure that those drug dealers who are peddling these poisons to our children, peddling these poisons on our streets, are held to account. My administration will continue to focus on this issue and take a multidisciplinary approach to tackling this crisis that claims the lives of 15 Pennsylvanians every single day. And I want to say to anyone seeking substance use treatment, we have a special hotline you can call for answers, 1-800-662-4357, or you can go on a comprehensive website, treatmentatlas.org, in order to access care in your region. I want everyone here in Kensington to know that we're never going to abandon this community or anyone in Pennsylvania who's suffering the disease of addiction. This is yet another tool in our toolbox, and you can expect that you will hear more from my administration, our colleagues in the cities and counties across Pennsylvania who are on the front lines of this fight. We have to work together to address this, and this is an important step in that process. And with that, I'd like to introduce Acting Secretary Davis Jones from the Department of Drug and Alcohol Programs here in the Commonwealth of Pennsylvania. Thank you.
Thank you. Good morning, everyone. Good morning. I am Dr. Latika Davis Jones, and I have the pleasure of serving as Acting Secretary for the Department of Drug and Alcohol Programs. And as a member,
I'm over here.
Okay, as a member of your administration, I do want to say thank you for your continued urgency around addressing the overdose epidemic. And as the governor said, his administration is taking a multidisciplinary approach to tackling this issue. It is an approach that he will involve enforcement, prevention, and treatment, and I'm here to talk about the treatment part of his administration's response. As the leader of the Department of Drug and Alcohol Programs, my department's focus is largely on expanding access to and increasing the quality of substance use disorder treatment across the Commonwealth. By doing this, we can ensure that more individuals are able to live a life free from addiction. We know that a substance use disorder, just like the governor said, is a chronic relapsing disease. It's a medical condition. It's a crime. It's not a crime, and it's not a moral failing. The longer we keep people alive, the greater the chance we have to get people into the care and treatment that they need and deserve. Today, we are right here in the epicenter of xylozine's emergence in Pennsylvania. We are right here in the eye of the storm. Over the past 2 years in Philadelphia, xylazine has contributed to more than 557 deaths. To put that into perspective, in 2020, xylazine was a contributing factor in 377 deaths across the entire state of Pennsylvania. We are now seeing xylazine in almost every community in Pennsylvania. And in many cases, xylazine is causing severe wounds that can lead to sepsis and amputation. And like the governor said, we continue to lose 15 Pennsylvanians a day to drug overdoses. These are individuals and are not just statistics. I know we ramble off a lot of numbers, but again, these are individuals and not just statistics. This is a public health crisis. Addressing fentanyl, xylazine, or any other emerging drug trend will require all hands on deck. We know that, one, we must keep up with the latest data, treatment, and resources to combat the drug trends that we are seeing. Number two, those battling the disease of addiction need our help with accessing resources. And number three, a strong public health and public safety approach must remain present to ensure that we defeat this epidemic. And in closing, I would like to echo the governor's comments and share a trusted resource that he actually already talked about. If you know someone that needs help or you need help yourself, please call or get help now line. The resource is available 24 hours a day, 7 days a week, 365 days a year. The number again is 1-800-662-HELP or 1-800-662-4357. Trained individuals can help you navigate local resources and treatment options in your area, regardless of your situation. If you're uninsured, underinsured, uninsured, please know that the number is there to help you, and there is no shame in asking for help. I'm going to repeat that number once again. It is 1-800-662-HELP. And I just want to say thank you for being here. And now I would like to introduce Kristen Rodak, the Executive Deputy Secretary at the Department of Health. Thank you.
Good morning. I'm Kristen Rodak, the Executive Deputy Secretary at the Pennsylvania Department of Health. I'd also like to thank Governor Shapiro for highlighting this very important public health threat. Xylazine is not only contributing to overdose deaths in Pennsylvania. Nationwide, there has been an increase in overdose deaths involving xylazine mixed with illicit drugs, particularly fentanyl. As the governor mentioned, the Department of Health already submitted the notice of intent to add xylazine to the list of Schedule III drugs under the state's Controlled Substance, Drug, Device, and Cosmetic Act. While our focus remains on harm reduction strategies and helping people get treatment for substance use disorders, we need to take action to help protect people from xylazine that is increasingly found in the illicit drug supply. And we need to do that without significantly affecting the ability of veterinarians and pharmaceutical dispensers to access legal xylazine to treat farm animals. We recognize that veterinarians have relied on xylazine for decades as a safe, effective animal sedative when used appropriately. And we know that the veterinary profession plays a key role not only in protecting animal health, but in protecting public health. This powerful drug was never meant to be used in the human body, and its devastating effects are leading to the deaths of our neighbors, family members, friends, and coworkers. We cannot stand idly by while this drug ravages our communities. As the governor said, making xylazine a Schedule III drug places tighter control, security, and record keeping on legitimate users and sellers to keep it out of the illicit drug supply. Because most large animal and equine veterinarians already have access to more restricted Schedule II drugs, such as those used for euthanasia of animals, they should already have the Drug Enforcement Agency license that will be needed to access xylazine. We are working with our sister state agencies, the Department of State and the Department of Agriculture, to make sure that veterinarians and pharmacists receive additional information about these changes. On Saturday, April 22nd, the notices of intent to temporarily schedule xylazine as a Schedule III drug and nitazene as a Schedule I drug will be posted to the Pennsylvania Bulletin. The Office of Attorney General will receive copies of both notices, and we anticipate scheduling the drugs in May. We must continue working together to protect all Pennsylvanians. I would now like to introduce Senator Christine Tartaglione to share comments.
Thank you. Governor, thank you. Thank you very much. For those of you out there that don't know, I'm an alcoholic. I've been in recovery for 20 years, so I know a little bit about addiction. I don't know what it is to have to get off of heroin or fentanyl, but I know alcohol was hard enough. In its purest form, government is tasked with keeping its people safe, and that's exactly what this change does. You don't need to go far from here to see the destruction that has been caused by xylazine and other drugs in this community, and too many others across Pennsylvania. Trank, as it's called on the street, is no secret to the people here. They've seen the damage it does to people who use it. And while I'm grateful for the governor, that the governor is taking this important step for naming xylazine an emerging threat, it has been a long time coming, and I am thankful for leaders like Governor Shapiro and President Biden for taking these vital steps. Just last year, I sent a letter to Senator Casey highlighting the emergency crisis we were seeing in our neighborhoods and how fast it's taking over. In the letter, I cited a study published in Drug and Alcohol Dependence, which found that in only a few years, xylazine went from being found rarely in Philadelphia overdose deaths to being found in more than 25% of the overdose deaths as of 2020. And the accelerated rate xylazine is being found on our streets, that figure has likely gone higher. Governor, I don't want to mince words here, so I want to put it plainly as possible as I can. This decision is the right decision, and it will save the lives of countless Pennsylvanians. Thank you, Governor. I now would like to introduce Councilwoman Ketsi Lozada.
Thank you, and good morning. I'd like to thank Governor Shapiro for this action. I'd also like to thank the community residents who joined me less than a month of me arriving in City Council when I called for a resolution to call on the General Assembly to add xylazine to the controlled substance list. Many of them are here today. Many of them spoke on the council floor about what their experiences were as a result of seeing these individuals in their community and how they were impacted by it. That resolution passed unanimously thanks to my colleague Sharon Vaughn and Councilman Jimmy Harity. Community residents are really the people on the ground who tell us what is happening every day. And actions like this one may not have been as a result of that resolution, but it is an action in the right direction. And so I'm grateful for the constant support that Governor Shapiro has given to this community. He consistently shows up. He consistently provides support. And these are the types of leaders we need relationships with, right? And so I'm grateful for him, for his administration. I'm grateful for the partnerships that I've been able to develop upon my arrival in City Council. To the Kensington community, we hear you, we support you, and we are with you to the end. And until we see an improvement in quality of life in this community, will we not stop fighting. So thank you again.
Thank you.
I'd like to introduce First Deputy Commissioner, Mr. Stanford.
Good morning. Good morning. I'm First Deputy Commissioner John Stanford, and on behalf of Commissioner Outlaw, I would like to express my gratitude towards Governor Josh Shapiro and his administration for taking a critical step in the fight against drug addiction and drug abuse by adding xylazine to Schedule III narcotics list. Xylazine is a potent drug that has been widely used as a veterinarian anesthetic, but it has recently made its way onto our streets and has become a significant concern for our department, especially in this Kensington neighborhood. The drug is often mixed with opioids like heroin and fentanyl, making it even more dangerous and unpredictable. Our officers have seen this firsthand, the devastating effects of xylazine in our community. It causes severe respiratory conditions, which lead to respiratory failure and death. It also induces a state of unconsciousness and paralysis, making it almost impossible for victims to seek help. Our officers are working endlessly to combat the opioid epidemic and drug-related crimes in Kensington. However, xylazine has presented a unique challenge to our department because it's not a controlled substance, and therefore it's challenging to prosecute it and prosecute those who are selling it and distributing it. The addition of xylazine to the Schedule III narcotics list will provide us with more tools to crack down on those who are responsible for spreading this dangerous drug in our community. The governor's decision to add xylazine to Schedule III narcotics list is a crucial step forward in our ongoing efforts to combat the opioid epidemic. It will allow law enforcement officers and agencies to be more effective in tracking and regulating the distribution and use of xylazine. It will also enable us to prosecute those who are responsible for distributions and sales of this dangerous substance. We know that addiction is a complex issue that requires comprehensive approach including prevention, treatment, and enforcement. And by adding xylazine to the Schedule III narcotics list, we are taking a significant step in the right direction. We are grateful to Governor Shapiro and his administration for recognizing the severity of this issue and for taking a decisive action to address it. In conclusion, I want to thank the governor again for his commitment to fighting the opioid epidemic in Pennsylvania and right here in Philadelphia. The Philadelphia Police Department looks forward to working with the state to implement the new regulations and to continue our efforts to make our street a safer Philadelphia. At this time, I would like to introduce the leader of the Pennsylvania State Police, Commissioner Parris.
Good morning. I'm proud to be here alongside of Governor Shapiro and our Commonwealth partners as we confront this health crisis head on. The opioid epidemic has reached every corner of our state and impacted people from all walks of life. Many here today have seen the suffering of a friend or family member and the devastating effects of drug addiction. The scheduling announcement today is another important tool in law enforcement's toolbox. As the primary law enforcement agency for nearly 1,300 municipalities in Pennsylvania, troopers regularly come face to face with the toll opioids have taken on our communities, from overdoses to drug-related crime. The Pennsylvania State Police continues to fight against the opioid epidemic on several fronts. A primary part of the department's response is keeping dangerous illegal drugs from reaching our communities. In 2022, the Drug Law Enforcement Division worked tirelessly to investigate and dismantle drug trafficking organizations operating in Pennsylvania. Troopers seized 60 pounds of heroin with an estimated street value of more than $2 million and nearly 350 pounds of fentanyl worth an estimated $7.5 million. In the first 3 months of this year, troopers seized an additional 24 pounds of fentanyl and 7 pounds of heroin. That's about $393,000 worth of fentanyl and $263,000 in heroin. Some of these drug busts were the result of long, complex investigations conducted with our Commonwealth partners. Others stem from troopers initiating traffic stops and observing actions and behaviors associated with criminal activity. The Pennsylvania State Police has equipped troopers with the drug naloxone since 2015. Naloxone is a medication that can reverse the effects of an opioid drug overdose by restoring normal heart rate and breathing. However, naloxone does not work on tranq. All members of the PSP are trained to respond to reported opioid overdoses and administer naloxone. Because of this, troopers have saved several hundred lives. In 2018, the Pennsylvania State Police launched the Ambitious Overdose Information Network, ODIN, an invaluable information sharing tool to help law enforcement and public health officials work together to save lives. ODIN entries are completed after an incident involving a fatal or non-fatal drug overdose, a naloxone administration, or drug packaging with identifying markings has occurred. Prescription drug take-back boxes are located at the 65 state police installations across the state, so residents have a safe way to dispose of unused or unwanted medication prior to them being abused. Prescription drug take-back boxes are available to the public 24 hours a day, 7 days a week. Unwanted medications in homes can be used improperly, resulting in deaths from both accidental and intentional overdoses. The Pennsylvania State Police collected a total of 3,422 pounds of medication through the Prescription Drug Take-Back Initiative last year. Additionally, 1,300 pounds of medication have been collected this year in the first 3 months of 2023. Finally, the state police take a proactive approach to keeping drugs out of our communities. Our community services officers offer free of charge presentations on drug and alcohol awareness at schools, businesses, and community centers across the Commonwealth. I would like to thank Governor Shapiro and our Commonwealth partners as we tackle this crisis head on, and I look forward to working together to making Pennsylvania a safer place to live and work. Amen. Thank you very much.
Thank you, Colonel. We appreciate your service and that of the women and men of the Pennsylvania State Police. And with that, anyone up here would be happy to entertain questions from the media.
How is xylazine purchased now?
How did I know you were going to yell out a question first, Jeff?
Good to see you. How is it purchased now? Can anybody buy it? How is it obtained?
Well, again, it's not scheduled right now, so it's fairly easy to access. The marketplace should be our veterinarians across Pennsylvania, but that is clearly not the case. I'll let the local police speak about how it's making its way out onto the street, but by scheduling it, we're putting restrictions on who can buy it, how it needs to be stored, and if that is violated, people can be charged and prosecuted. Anyone want to add anything to that?
Governor, do you think that it's coming out of veterinary offices, though? I mean, they've got access to it.
I'm not in any way, shape, or form accusing any veterinarian of doing anything wrong. What we know is that these drugs are making their way out onto the street. We know that law enforcement is doing a fine job of trying to stop that. This effort today is going to strengthen their hand and put another tool in their toolbox.
But vets will now need a license. They're going to be licensed.
As you heard from the Department of Health, they're already licensed and they're already dealing in Schedule II narcotics. They already have the necessary license. We've been engaged with our veterinary partners to make sure they knew this was coming and that they already have storage facilities. They'll now need to keep the xylazine in those storage facilities. We don't anticipate any disruption in their lawful activities. And I want to just stress again, Jeff, I'm not suggesting any veterinarian was doing anything wrong. Law enforcement can comment on any individual cases going forward.
Yes. Fentanyl, if you touch it, it gets into your bloodstream and bad things can happen. How about with this drug? Can you touch it and or does it have to be injected into you?
In reality, most of the xylazine we're seeing is combined with fentanyl. That's tranq. And so handling this is still incredibly dangerous.
To follow up on what Jeff was saying, so in terms of, are people buying this online? How are they getting it?
Well, again, I think law enforcement can comment on the stream out into the communities, but through the mail, online, we're seeing this make its way into the illegal drug trade in similar ways that we're seeing fentanyl make its way into illegal drug trade.
And then in terms of looking ahead, you sort of gave an explanation, you and others gave an explanation of how the presence of xylazine has increased here in Philadelphia and around the state. So, as you know, it can be sort of a moving target when you're looking at what's impacting the drugs on the street. What are you doing right now to look for the next xylazine so that it doesn't get to this point?
Working with our law enforcement partners and the leadership of Colonel Paris at the State Police, we're always looking to see what's next. I think the example I gave about nitazines and how we're scheduling those as a Schedule I narcotic is an example. We've not seen the level that we're seeing of tranq, yet we know that is an emerging threat. So we're getting on that ahead of time, and I will not hesitate to use my authority as governor to schedule other drugs should that be needed if we're finding them on the streets of this Commonwealth being used illegally.
Governor, I don't see the Philadelphia District Attorney's Office here today. Maybe they are the representatives. Have you worked with them on, the protocols for charging these new cases that come in?
Every DA has the authority and the ability to prosecute the cases they want. You'll have to ask DA Krasner if he plans to prosecute these cases after Philadelphia Police or the State Police charge them. Jillian?
Yeah. Do you support safe injection sites now that it seems that Safe House will settle with the federal government?
My position on that has not changed. I do not support safe injection sites here in the city of Philadelphia anyway. Hang on. Did that answer your question? Okay, go ahead.
If Philadelphia were to move forward with one, what action would you take as governor?
Well, we're studying the potential outcomes of these conversations that are apparently occurring between the Department of Justice and advocates here in the city of Philadelphia to see what authority I have as governor to take action. I would also just respectfully defer to the state senator here. If legislation is needed, I know that there's been a group working toward that. I'm going to let the state senator answer that. But suffice to say, we'll be prepared to take action should that become a reality.
Do you think
Senator?
you have power?
Senator?
We have Senate Bill 165, which is to prohibit safe injection sites throughout the Commonwealth. We have legislation that is ready to move when we go back. We also, Senator Street, Senator Dillon, Senator Tony Williams, and myself filed to intervene on the Safe House case. So more to come after this.
And Governor,
And
you
to
would
answer
sign that?
your follow-up question on that, I do believe we have some authority that's vested in the governor and through our agencies. Obviously, a legislative solution like that would be the most comprehensive.
And you would sign that bill?
I'd have to look at the bill, but in general, my position on this issue hasn't changed. I don't support safe injection sites.
One more, I think, Daniel.
Governor, is the administration concerned about a potential increase in the usage threshold that could tilt xylazine into a Schedule 2 or even Schedule 1 drug?
Well, we'll constantly be reviewing the effects of this order I'm making today. If adjustments are needed, we will make those adjustments. And understand the differences between Schedule 1, 2, 3 doesn't make it any more or less legal or illegal. It's just the other uses of these drugs. And so we think it's appropriate to make nitazene Schedule 1, xylazine Schedule 3. But the bottom line here is by scheduling it, we are giving greater tools to law enforcement and others to properly regulate, control, contain these drugs, and if need be, make arrests and hopefully prosecutions.
And how often do you plan to interface with Senator Tartaglio or even Councilwoman Lozada as the administration continues to monitor the opioid crisis in Kensington?
My office interfaces with their offices on a very regular basis, and I do as well. You heard from the councilwoman. I'm back in Kensington. I've been here multiple times as Attorney General, making arrests, visiting with the community, and now as governor, utilizing the authority I have to continue to try and address this crisis in a multidisciplinary way. And one of the ways you can be most successful at dealing with something in a multidisciplinary way is having multiple partners, as we do here today. You'll notice we have public health leaders, we have elected leaders, we have law enforcement leaders from the state and local level. It's critically important that we work together, and that's the approach my administration is taking. And I'm finding with all of the people assembled here a willingness to partner and work together, and I'm grateful to them for that.
Can we hear from John Stanford?
Governor, can I also just add, the governor is also not just approached this from a law enforcement perspective, but he's also made available significant resources, making permanent the additional crime prevention dollars that we funded through emergency dollars last year in his budget proposal, which hopefully we'll adopt.
Commissioner, are you able to charge now with xylazine or not charge when someone possesses it?
So in terms of at this point in time, we will work with the district attorney's office to move forward as to how we will go about doing that. Again, the governor's move today gives us an additional ability to charge to move forward. And as was stated, we have seen an increase in xylazine on the street. And now this again gives us the ability to move forward with some of those investigations with the ability to charge individuals for selling, for distributing it. So again, this move today gives us the additional tool. But again, we will work with the district attorney's office as to how we will move forward with that process.
But prior to them scheduling it, they'll do it in May, they say. Prior to that. Now, can you charge on it?
No, and that's the piece of not having the ability to do that. This now gives us that ability.
Thank you, everybody.
Thanks, everybody.